CEO.
Half a day visionaries. Whether you're running a small business, planning a new hospital, or strengthening your community, a strategic plan helps you determine what needs to be prioritized and where you need to spend your time, energy, and resources. As an urban planner, I have seen successfully executed city and regional plans guide growth. These plans helped improve the welfare of the people and their communities by creating a more convenient, equitable, healthful, efficient, and attractive place for current and future generations. There are many organizations in the private and public sectors that have been able to meet challenges and overcome roadblocks because they had built a strong foundation with a strategic plan guided by a vision. This next speaker understands that strategic planning can help ensure the success of any venture. Ladies and gentlemen, allow me to introduce Margaret Bengzon, Head of the Medical City's Strategic Services.
Is this mic working? Yes, so good afternoon, half a day. First, allow me to thank the governor, Troy, the organizers of Imagine Guam. Really been such a thrill to be part of the health team that's been coming together over the last few weeks. And now to be able to speak to you today is such a great opportunity, such a great honor. So, moving right along. There. From good to great. So from good to great what? Over the last few months and weeks, we've been working as part of Imagine Guam to really come to a collective vision of what Guam will be like, how we'd like Guam to be like 50 years hence, 2065, Guam 2065. And coming to that collective joint vision, we're also looking to develop a plan, a strategic plan, a master plan that takes us to that vision. And so I want to talk a little bit about plans and what makes a plan good and what makes a plan great. And as a peg to this, I need to draw from, and I will draw from, the organization that I know best, which is the Guam Regional Medical City. So, the plan is the product of the mind, the product of the brain, really. So I thought that we could use the human brain as the framework for understanding what makes a good plan, what makes a great plan. And so this is a picture of the average human brain. And this is the picture of Albert Einstein's brain. So good. What happened to my good? Good, and then great. So let's use the great as a graphic. And we all know that the brain is actually made up of two hemispheres, the left hemisphere and the right hemisphere. And it was actually a biologist-psychologist named Roger Sperry who came in the 1960s to an appreciation that these two parts of the brain actually work very differently. And so the left brain is really the brain that's analytical, that's logical, that's sequential. And so when you think about language or mathematics or reason or process or systems, this is the side of the brain that we're using. In contrast, you have the right brain, which is really the home of artistry and imagination and emotion. So this is the side of the brain that's visual and intuitive and creative. So kind of like this. Left brain, right brain. So let's start with good, a good plan. So drawing from the left brain, a good plan needs to be based on good data, good information. And what makes information good is certainly its reliability, its accuracy, but more important, good information is information that you can act on. And I'd like to share with you some of the information that we looked at, some of the data that we looked at when we were planning the Guam Regional Medical City. So this is the first thing. This is a representation of the Guam healthcare market. And what you see here is fairly robust growth over time, 8%. Certainly more robust than the economy as a whole, which has been growing about an average of 2%. But what you also see here is, as a percent of gross domestic product, healthcare expenditure still lags the world as a whole, and still lags the US certainly. And so this tells us there's quite a lot of opportunities still for further growth. And underlying this growth, are certain demographic factors. So what you see here is that Guam's population is growing more rapidly than the US and the world average. So it's going to slow down a little bit in the coming years, but still fairly high number. So Guam population is growing. Guam population is also growing old. So you see here a comparison of male and female average ages. And you see here today, about 7% of the population is over 65. By 2030, it'll be at 10%. And that number, that percentage will keep escalating. So we have a population that's growing. We have a population that's growing old. We also, as we know, have a very sick population. And if you take a look at this section of the chart, for example, compares disease burdens, US average versus Guam, you'll see heart disease, diabetes, cerebrovascular disease or strokes really exceeding US averages by an order of magnitude. You see cancer. So cancer incidence increasing certainly, but in most parts of the world, deaths from cancer have actually been declining. So we're beginning to make a dent in other parts of the world in the battle against cancer. In Guam, however, that's not the case. We're seeing percentage increases in deaths from cancer up to 100% for males. Diabetes, also crazy numbers. In the States, on average 1 in 10, in Guam 1 in 5, so double the incidence of diabetes. And the thing about heart disease, about diabetes, about cancers, is that these fall under the category of chronic disease, which is disease that lasts over a very long period of time, and disease that is quite needy in terms of resources, very resource intensive in terms of managing this disease. And so even as we have that, even if we have a disease burden that's very much driven and skewed towards chronic disease, we don't have the specialized care and services needed to address this disease burden. So we're saying Guam is we're getting more, we're getting older, we're getting sicker, but before the Guam Regional Medical City, there was already a significant gap in terms of bed capacity. So we had scale issues, we also had scope issues. We did not have the facilities, we did not have the professionals to deliver the care, specialized care, subspecialized care even, that Guam needed and the region needed. Another graphic comparing average physicians and nurses, US average versus Guam. And what you see here, the nurse, about half the nurses that the US have on average, and for physicians, a third of the physicians relative to US average. So, we all know this, nature abhors a vacuum. And so, every year, some 15,000 people, a good 10, almost 10% of our population, have had to travel abroad for healthcare. We all know this. We all have friends and family who've done this. We might have done this ourselves. And this has resulted in some $60 million leaving Guam for healthcare as a result of the need to access healthcare. If we look at the other Micronesian jurisdictions, you'll see a similar situation. So huge gaps, huge discrepancies in terms of the amount of resources devoted to healthcare. Physician to population ratios, another indication of resources, also deficient. And if resources are deficient, the outcomes will also be deficient. So you see here life expectancy, less, chronic disease deaths, more. And what you also see here is that we all know if Guam is challenged with respect to healthcare, these jurisdictions are even more challenged. And so they've had also to spend monies and bear the dislocation of having to travel for healthcare. So huge percentages leaving the island for healthcare. And why do we care about these jurisdictions? We care because we've had to really step up to the plate in terms of caring for these persons from the Micronesian region with respect to healthcare and with respect to other aspects of social services as well. They're growing in number, as we know, and the costs necessarily of providing care, of providing social services to these groups are also growing. So our system is already burdened with our current population, and now we have to deal with this migrant population that has large needs and not a lot of resources. So that's the data that we took with us. Now the thing about data is you have to use the data to come up with good conclusions, sound conclusions, based on sound principles. So what are some of these sound principles? Some of these good conclusions. So you have to be close to your market. Your market has to be able to access you. And so that's why we located in Dededo. This is where the largest populations are. This is close to the tourist destinations. This is close to the military installations. You have to deliver the services that your customers, your patients want and need. And so what you see here is we delivered bed capacity, sufficient to cover the gap, partially cover the gap with respect to bed capacity. And we've invested in facilities and services precisely directed at delivering the specialized and subspecialized care that we need in order to make a dent on this terrible burden of chronic disease. So cancer services, cardiovascular services, diabetes services, stroke services, and more. So these are just some pictures for those of you who haven't visited our facility. This is our facade. This is our lobby. We have a 30-foot, I think Judy Flores is here. This is actually her work. It's an incredible piece of work. Very robust, very advanced diagnostic facilities, imaging, laboratory, cancer. So we have the first inpatient comprehensive cancer center in Guam and on the region. So very advanced radiation therapy, infusion, and surgical facilities to support all aspects of cancer care. Cardiovascular care. We have the first and only cardiac catheterization lab in the region, inpatient. Nursing units. Physical therapy. I wanted to show you the hyperbaric chamber. I missed that. Where'd that go? There you go. So, the thing about diabetes is the biggest damage that diabetes creates is really in the blood vessels. And we all know that when you have a wound and your blood vessels are compromised, the blood cannot flow to the wound, and so healing is compromised. And so in the past, diabetic wounds we've had to deal with basically through amputation. But not anymore. Not through our Advanced Wound Care Center, which has a hyperbaric oxygen chamber, not one hyperbaric oxygen chamber, but 2 hyperbaric oxygen chambers, so that now we can save limbs even as we're saving lives. So, you know, no matter how great the facilities are, it's about the people. It's about the people who are delivering the service. And we have brought together really an amazing team of specialty physicians on Guam to care for Guam and the region. These people are experts in their field, have excellent credentials, and they've come to Guam because they've been enamored by our vision. And they want to be a part of realizing this vision. Our cardiovascular team, Marian Holland, who is a cardiologist, electrophysiologist. I'm having trouble with this thing. There you go. Arvind Shaker, who's an interventional cardiologist. Umer is a pediatric interventional cardiologist. And Noel Concepcion, everybody knows Noel Concepcion, cardiothoracic surgeon. Our cancer team, Paul Cody, medical oncology, hematology. Arthur Coe, radiation oncology. Anna Sanchez, pediatric hematology oncology. So specialists heretofore unheard of on Guam. Neuroscience stroke team, Justin Hale, neurology. David Warren-Garden, neurosurgery. Scott Shea, interventional neuroradiology. Specialized, subspecialized people who are now available to us on Guam and the region. The diabetes team, Ron Innerfield is an endocrinologist, and she is a former anesthesiologist who's taken up wound care, and she runs that advanced wound care hyperbaric chamber that I was talking about. Specialty surgery, we have Ramsey Shishakli, who's doing urology. For many procedures that are first being done in Guam are being done by him. Jason Han, ENT, and a specialty that's been sorely needed and sorely lacking, orthopedic surgery. Specialty orthopedic surgery, including spine and limb repair. So, more on the principles. We're an acute care hospital, but we also know that acute care is the most expensive and also serves the least number of people. So as healthcare providers, and as healthcare providers who want to make a real impact in improving the quality of life on Guam, we need to be concerned about the base of the pyramid too, which is really the best buy, especially when we're concerned about chronic disease. And so, even in an acute care setting, we have a Center for Patient Education that is offering programs focused on health promotion and disease prevention and living well, living healthily, even in the face of chronic disease. This is the center. This is our patient portal, through which you can access online resources across a variety of fronts on wellness and disease. Now, speaking about the healthcare continuum, currently, we're only a hospital. But for healthcare to produce good outcomes, for healthcare to be accessible through lower cost, healthcare needs to be integrated across various settings, inpatient and outpatient, diagnostic, treatment, rehabilitation. And so even as we're starting with the hospital, we're looking to the need to think about connecting with and possibly investing in other platforms for healthcare. And together, we beat this dichotomy of good quality and cost. We're able to deliver good quality healthcare because healthcare is continuous, and we're able to engage the patient throughout all his healthcare needs in various healthcare settings.